A year ago, things looked bleak, a patient backlog and a COVID peak. Yet in that moment of despair, we pulled together for patient care. First things first, we set our sights high, half the backlog by July. 7-day working and extra space. To our surprise, we kept pace. For the blood, the sweat, the tears, we shone out brightly amongst our peers. But our pride is in our patient care, our reason for being, our cause to be here. The backlog mountain is now a molehill, but we have much work yet to do still. So forward we go with quality firstly, more of the same to achieve 2030. Our final note, in case you didn't know, we are the endoscopy team from Co. We use cameras to look in your belly, and now we ourselves have been on telly. Thank you very much.
Fantastic. Awesome. Did anybody need a tissue? Because I was kind of tearing out. Definitely.
Thank you so much.
Oh, you feel your point was so adequate though.
Well, we try to summarize the effort that we've all, as a team, from porters to admin to clinicians and nurses, all together we have tried in this very difficult time, and I'm very proud of my team. And this is just a very small part to describe the blood and sweat and hard work everyone of the team have put in. So thank you very much for giving us this opportunity.
Thank you so much. Please let's give it up for you. Oh my God.
Thank you, guys.
Thank you so much. I wouldn't want to be the team following that. Just joking. Okay, so no pressure, I promise. So next we have planned care, and I believe they're in the house. Planned care. See, this one I left over there. Laura. Give it up for planned care. Planned care. Planned care. They are stepping to the stage.
Oh, they're coming from all angles.
They were dotted around the room for effect.
Yes.
All right. Planned care. So, why are you hiding to the side? I know your moments.
Centre stage.
Centre stage. Let me get out of the clip.
We've seen enough of you.
I know, right? I've seen enough of me. Off you go.
Okay, I'm George. I'm the specialty coordinator for that, and we have.
I'm Antonia Moynihan, and I'm the data quality and assurance lead for the Medicine Healthcare Group.
I'm Carla Harris, specialty coordinator for rheumatology, neurology, and respiratory.
Thanks. Okay, so our proudest. Can we go to the next slide so I know what I'm talking about? So our proudest moment at the moment is that we have reduced all our review lists from 2019 to 2020 and to 2021. That took a lot of work. And this means that we will deliver better patient care, which is obviously why we're here. We've made additional capacity over the weekend, so again, we're working 7 days with the help of consultant companies. And again, so this has made the reduction of the review list. And as I've said, it's a massive team and a massive effort to get through this, which I will talk about later. And we always kept our sense of humour. I don't have an example, but it was really funny. Okay, next slide, please. Okay, so at the beginning of the year, it did feel very impossible. We already had review lists, and then we had COVID, and then we couldn't see anyone, as you all know. I'm not telling you anything new. But now we've achieved something. So the next slide will tell you what we've achieved. Okay. So you can all read there's a lot of patients on our waiting lists, our review list that weren't being seen. And we reduced this by 97%. So that's all down diabetes and look at us go. Next slide, please. So to achieve this, we've had to work not just with ourselves, but like a wide range of teams. And these are just a few of them. We've gotten to know them personally and professionally. The amount of times we've been talking to them. You can read. So next slide. So this, yeah. So we've been working with the booking team. So got Rachel, Reese, Sherry, and all our lovely other people that've been helping to book all the patients last minute, as it is. And we've been lots of other people. Yeah, we do have a greater understanding of what's going to happen. We are looking forward to booking more clinics, more people to complete the lists, and hopefully we'll never have a review list again. There'll be the no capacity list. Next slide. Oh, this is Antonia, so passing over.
Oh, thank you, George. I only recently joined Princess Alexandra in January of this year. With it came a lot of data cleansing and a lot of double booked patients. So our review lists may have looked large, but it took a lot of data cleansing, going through, making sure patients might have had appointments and might have been on planning forms. So part of my role was to make sure that all of the people on the review lists, all the people that were on those forms actually needed those appointments and that they were true figures. And with the help of the information team pulling reports, it helped me to do that more efficiently and quickly to make sure we're running the best service. To speak next. Okay, over to you, John.
Hello again. Okay, can I have the next slide? Thank you. Right, so we are obviously continuing to strive to improve our patients' care. And obviously, though we are booking all these patients and making sure that they get the true care that they need, it's still a work in progress. We still have lists, we still have patients, but like I said before, we'll get there one day. Next slide. Oh, look, this is us. And we've even got someone on the laptop who wasn't with us, just to include the whole team together. That's how close we are. Next slide. Oh, well, that was it. So, yay!
Thank you so much. Let's give it up again one more time. You can do better than that. Okay, so next we have rheumatology in the house. Yes, yes. Ah, right there, center stage. So we have a video and then somebody will, I guess, speak.
Decide who's going to speak. I'm not sure which one's working now. We'll start with the video, sir. Yep.
Rheumatology patients have been having a difficult time during COVID. In the very early days, we did not know how serious the disease was, and also rheumatology patients are on immunosuppressive drugs, and the immunosuppressive drugs increase the risk of infections. So it's very difficult for the patients. They're very apprehensive to see what is the impact of these treatments on getting the COVID. But equally, they're very worried about if the treatments are stopped or delayed, what effect it will have on them. So therefore, I think it was not an easy time for the patients and for the carers. So, but however, the whole rheumatology team, with the help of doctors, nurses, and management, I think we came up with a plan, almost like a personalized plan for care. And I think that helped us, our patients, to get through these very difficult times and uncertain times. And we managed to give safe treatment as well as effective treatments.
Taking it forward, so that it was decided as a team that we make a departmental disciplinary team meeting with based on the case-based discussion on each complicated and challenging cases of rheumatological patient. Our meetings were based and discussions were based on the updated COVID-19 ESR guidelines.
Our NDT team comprised of consultants, specialty doctors, pharmacists, clinical nurse specialists, and the admin staff. In the peak of the pandemic, our all staff members, they were having communication through the Teams app so that we can respect the measures of social distancing.
The rheumatology service covers a huge area from Stansted Airport to the City Airport, and despite these numbers, we've continued to work hard to get our patients the treatment that they need while COVID has been happening, and I'm very proud of my team, or our team.
Having the CBD meeting have meant extra work for our team, such as gaining enhanced informed consent from our patients. But we're very proud of the work that we have done and have been able to present our practices at the Essex Rheumatology Association meeting, which was very well received by our colleagues.
Our practice during the COVID-19 pandemic in the department was shared as well with the European Association for Rheumatology, EULA, and our article was accepted as a poster presentation and later on published in the Annals of Rheumatic Disease 2021, which we are really proud of.
Really, in COVID, our patients, with all the difficulties, but support from the rheumatology team, nurses, doctors, managers, and the plan which we came up was very useful. I think we managed to successfully treat people with autoimmune disease or conditions, despite the risk of COVID. There was a personalized treatment plan. It worked very well, and we're really proud of it. I think we also managed to share this in the region, in the Essex Rheumatology region, and I think the team also presented this as an abstract to a ULAB meeting, and it's a really good achievement. But most of all, it benefited our patients, and that's what really mattered. And we are very happy that even in these difficulties, we managed to help our patients and continue to do so.
Okay. Let's give it up for rheumatology. Would you like to come and say a few words? Yes? Come on, if you're in the team, you're on the stage. Don't make me get angry. Okay, so if you want to stand, you can stand in front or on or both or not. No, you can't do neither. So just come in because you're on camera. Oh no,
So,
who said oh no?
So I think thank you very much for giving us a chance to share our proud moments. I think in PH it's always challenging, it's not easy, we're all in with work for understandable reasons. But I'll just first introduce the team.
Shamim, specialty doctor.
So I'm Khalid, I've been here for a long time, so hopefully you don't need many introductions.
I'm Sachin, I'm the rheumatology pharmacist.
Samir Siddiqui, I'm the specialist doctor.
Janet, I'm the rheumatology secretary and I've been here a long time.
Thank you. I think very briefly, I want to repeat what we said, but the issue was an infection in patients on immune suppressive therapies. I'm sure same is shared in cancer and some other specialties who deal with autoimmune conditions. So we had a really challenging time. We had to come up with a plan where patients are still treated, but are not at risk. So this was we won't go into details, but special meetings were set up as a group where multidisciplinary pharmacists, admin staff, specialty doctors, and the idea was to discuss each and every patient as per British Society of Rheumatology guidelines and national guidelines, and how we tailor treatment for patients on what we call biologic drugs, very immunosuppressive drugs. And I think that was very important to our patients because all the treatments were initially put on hold. There was a blanket restriction because of the risk, but subsequently with guidance, and that kept on changing. I'm sure most of us share changing guidance with an evolving disease, but I think we did very well, and I have to say all credit to all members of team and to our patients who were very actively involved. Each time we had a case discussed, patients were contacted, their views were shared before any final decisions were made. But any other member wants to, Shashini, you want to add a few words?
I mean, it was a balance we have to keep because of the infections, as Dr. Ahmed said, and the new guidelines which the BSR was issuing, that there were always some restriction, and then the patient's condition, because it's a chronic disease, they need treatment, it's difficult to stop it. So it was a balance in keeping up the treatment plan and the safety measures following the guidelines. So hopefully we came out with it.
Sounds amazing. Thank you so
Thank
much.
you very much. Thank you.
Give it up for rheumatology. Okay, so what we're going to do, we're going to try and keep it simple. So the OD and communications team are going to be doing the count. I can only speak for OD, Learning and OD, which is my team, that we have not accepted any bribes. I can't speak for anyone else.
That feels a bit harsh.
Only speak for me. So what we're going to do is I'm going to read out each team. And then remember what I said earlier. I know some of you came late. So I said with a show of hands, you're going to kind of just, put your hands up, and then the teams will count the vote. I did say earlier, for those of you that just joined us, it's just hands, no legs, no chairs, just hands. That's all we'll be counting, just so you know. So let's give it up for neonatal intensive care. I wrote this down. I hope I get it right. This was that team, yes? Neonatal. Yes. So let's do it. But you can vote for yourselves. I would, right? Put all your hands up. So let's do a count. Neonatal intensive care units. Keep your hands up, keep your hands up, some exercise. Build the muscle. One vote. No. Wait, help. Lauren, can they do multiple votes? Oh, really? Oh,
Do you want to go
that's all
again?
me. Okay, I think we need to start again. My apologies, I didn't read my notes. Okay, so.
Good job we've got Lauren to keep us in order.
No, she just wanted to say that.
Yes, I know. Attention seeking.
Okay, so if you want to vote for neonatal intensive care units.
There we go.
That's why I said you should put your hands up for yourself, right? You good? Okay. End of life care. Yeah. Okay. Virtual visiting.
Can't hold my breath while everyone's got their hands up. I have no idea why.
Neither do I. Oops.
When you've got a moment.
When you're ready, Randy.
Yeah.
I'll keep everyone. Audiology. So do you know who the team is? So audiology, yes, so that. Audiology. Can I vote?
Yes.
That's them there. Okay, now you behave. Sorry, Laura, I know you're just about to tell me off.
Yeah.
Endoscopy.
I think there might be some cheating. No, but she's not cheating in a discreet way, so.
I said hands will be counted. If they have to, they're smart. So that's why you have to listen.
Hands are counted.
There you go. Are you confusing?
Yes, no Mexican waves.
Make sure you get the whole room. Okay, okay. Planned care. Okay. Rheumatology.
See, rheumatology were very quick off the mark for voting.
No, I said hands. You can put 2 hands. I said we're going to count hands. He's like, no, we're going to do this the proper way.
Change the rules, Mandy.
I didn't change rules at the beginning. I said hands. The only thing I said was no feet and no chair. You turn upside down and try and get that counted. But he said, you put that hand down. Oh,
yes, I know.
That. Okay.
In good order.
So, while I wait, it's been a long 3 days. I can't even think of anything to say. So while we wait for the count, you can all hold your breath. So we have one prize winner. And I said at the beginning that the prize was related to Jeff Bezos, and I think everybody got it. It's an Amazon gift certificate for $50. Sorry. Oopsie, for £50. How much did they pay you? That's a lot.
She's not cheap.
Okay. So, the winning team. No music for some little horror. The winning team is endoscopy. Now, I don't know. Fantastic. Congratulations. Don't start thinking about how you're going to spend that $50 yet. Now, pounds, sorry. So, as you see, I don't know if you saw that I was summoned to the side earlier. Did anybody see that? I was like, come over here. Get said to me. And she dragged me into a huddle. And she said, how much are we giving again? And I said, £50. Pounds. And she said, and the others? And I said, just congratulations.
500.
Wait, why are you confusing me?
So on the slide is the amount.
But on here,
yeah,
it's 50. But anyway, let me land the plane, please. I know I'm still circling. So as I was saying, so I was called to the side and I was asked, so what are the runners up, the others getting? And I said, well, nothing, just say, congratulations, a round of applause, thank you for coming, grab a soda on your way out. And they were like, that's not going to fly. So I have been given permission and I'm so happy and excited. And I think we really need to give it up for our execs when I say this, is the winning prize is now $250.
Wow. You spoiled it.
I know. And dollars is worth nothing now. So the winning prize is £250. But we were so impressed, and I know I was, and everybody else is going to get a £150 Amazon gift certificate as well. So that is. So thank you so much to our exec. So thank you to all of you. I know it's not easy. Sometimes it's not easy going up there. Trust me, I know. Don't be fooled by how it looks. It's not easy. So you will be getting your prize.
Yeah, so if we can have a contact email sent to the communications inbox and we'll email you your voucher.
Awesome. So once again, I think we should give a real round of applause for everyone because this was amazing. I am proud to be PAHT. Give yourselves a stand up. Give yourselves. Thank you so much. As I like to say, I'm PAHT proud. Thank you everyone for coming.
It's cold. Commons now. Well done.
Well done.
We could take
You occupy this stage? Or?
Yes. Just stop. I'm often going to use one of the cameras. That's too much fun.
They said yes. You can figure out, I don't know, because of the social distancing.
Yeah. Always. Welcome to the team. Have you not had lunch? Yeah. It won't be long. I just want to talk to Rachel about because we've got a lot of P2s and other courses. It was live streaming through that. You guys have been on the live stream. Yeah. I was last night by mistake. I was watching it from home. Maybe the camera. I didn't like switching the camera on. It was like.
Then you're.
Hi everyone, just a quick reminder as you might be leaving or staying, we've got the next session at 3:15, which is Patient at Heart, meeting our patient experience team and hearing some great practical tips from them and sharing some experience and stories. And then for those of you who signed up to the quiz starts from 5:30 to 8 p.m. And that's for teams that are signed up to attend tonight. So thank you again for coming. If you're leaving us, I hope you'll come back and bring some colleagues at 3:15. Thank you.
Perfect. Yeah. Yeah, you do try. You do try. We've obviously not got it very right. No, obviously not. Yeah. Yeah. If it's they won't contact you. But if it's genuine, then they'll contact you. Oh, lovely. Well done. Go for it. Well done. Oh, yeah, really then. All right. Okay. I'm going to get back later. Do you want to carry on with dinner, or do you, yeah, do you want to do it here or over there, or if it's convenient. Oh, we need to go. Yeah.
It's not really for us.
I thought, no, I think that's for Alex.
That's for Alex.
So, were you?
No, we were on the training session.
Oh, you were? Okay.
You know, on the training session.
Okay. Yeah. Well, normal. Oh, yeah. Never forget these. Said nobody from PH went to the training. I'm out of your lane now. I'm out of your lane now.